You're watching Moms Matter, and I have Dr. Rebecca Lane, who is a urogynecologist here to talk all things UTI, menopause, and why is it that when we jump on the trampoline, we might pee in our pants. Thank you for being here with us. I know you are so busy. You work full-time as a doctor, you have your children, and you're juggling so much, and you have all the answers for us. I'm so excited to have you here right now.
Well, thanks for having me. I want to share the answers.
I mean, Dr. Rebecca, we just talked about how so many people are complaining, myself included, about reoccurring UTIs nonstop. What does that mean?
Well, it can be a number of things. It can be UTIs that are either not fully treated and they're kind of relapsing versus UTIs that are actually treated and then they're coming back. And then one thing that I would say, not to make any presumptions about your age, but what I notice is a lot of women are coming to me in their 40s and 50s and they're saying like, I haven't had UTI since I was in my 20s and having all this crazy sex. And why is this now happening again? And what they often don't put together is there is a hormonal connection as we kind of start to enter into the perimenopause. Our vagina and bladder are not free from the menopausal symptoms.
So how do you determine that though, right? Like someone will come to you and complain they're reoccurring, and let's say you determine that their infection is clear, right? Then what's the next step?
So depending on how frequent it is, I'll offer something preventive. I mean, if it's really recurring like that and running your life and making you afraid to have sex, if that's what brings it on, actually vaginal estrogen is the best way to prevent recurrent UTIs in women who are in menopause or perimenopause. So you don't need to be on like a permanent antibiotic. It can actually save you from all these repeat courses of antibiotics just by having some local estrogen in the vagina.
Wow. And doesn't that help with other things as well?
Yeah, absolutely. So there's a constellation of symptoms called genitourinary syndrome of menopause. So when we think of menopause, we think about hot flashes, but of course, menopause is the decline of estrogen. Our ovaries stop making estrogen, and we have estrogen receptors throughout our body. So it doesn't just cause hot flashes. It can affect, from head to toe. And so the way in which it affects the vagina and the bladder is called genitourinary syndrome of menopause. And so typical symptoms are recurrent UTIs that we talked about, also pain with sex, vaginal dryness. Some people even just walking around or wearing tight jeans is uncomfortable because the vagina gets so dry. Also just a change in the vaginal microbiome. So recurrent BV type infections or a different odor because the pH is starting to change, and that's kind of the new normal, but it takes an adjustment. And also a lot of women will experience urinary urgency, frequency, maybe now they're starting to wake up a couple of times at night to go to the bathroom. And there's this also bladder sensitivity. So some women come in and they feel almost like it's a UTI, but their cultures keep coming back negative. It's not a UTI, it's a sensitivity. And sometimes they'll notice, okay, there is an association between maybe eating spicy foods or acidic foods or just a sensitivity to maybe what you're eating and drinking. So
wow.
It's a whole constellation of symptoms, vagina and bladder, all of which can improve with the local estrogen in the vagina. So
that's incredible though. Like you specialize specifically on this, and this is something that affects every single woman at one point in her life.
Statistically, probably about 80% of women will have urinary incontinence at some point in their life that's bothering them. And sadly, it's just something that women think they have to live with. I think women really are not aware of all the treatment options that we have available now, and we have a lot of them. So I appreciate you kind of putting a spotlight on this because it's very treatable. There's no reason to be, wearing pads and suffering with these things.
I love the idea that you don't have to take an antibiotic necessarily, and that through a vaginal estrogen cream, you can dissipate a lot of this discomfort. Like to me, that's just like, I just want to scream from a rooftop. It's incredible.
Right. No, it's I kind of call it a no-brainer. It's almost like a vitamin in my mind. I think all my patients should be on it, and I think as women, we have this tendency to kind of try to grit our teeth and get through everything. And this is one of those things where that's not what you need to do. Like this can be a progressive condition, and it's better to jump on it early. And there really are, I would say there are no, downsides, virtually no risks, no downsides, and hardly any contraindications to vaginal estrogen. Now, there are some people who cannot take systemic estrogen replacement, menopausal hormone therapy. That's a whole other conversation.
Right.
But the vaginal estrogen is very local. So it's getting absorbed into your bloodstream in such a minimal amount that even active breast cancer patients who have estrogen receptor positive cancers, their oncologists are almost always on board for the use of these things. That's how safe they are.
That's great news.
Yeah. Yeah.
I want to shift for a minute to, after we have children, many of us have 2, 3, 4 kids, and then things kind of change for us. So you go to a workout class, you're running, and all of a sudden you're like, oh my God, did I just pee in my pants?
Right.
I mean, other than surgery, is there anything that can be done?
There are. Yeah. No, it's an important thing to bring up as well. So first of all, I want to say, so that's called stress incontinence. If you're exercising, jumping, laughing, sneezing, and a little, few drops of urine come out, we call that stress incontinence. And that is due to weakness of kind of the pelvic floor muscles, and it can happen most often after childbirth, pregnancy. So the surgery is the gold standard treatment. It's a 20-minute outpatient procedure, very safe, very effective. But for people who don't want surgery, there are other effective treatments. So one is actually pelvic floor physical therapy, like strengthening the pelvic floor, Kegels exercises. There's all sorts now of devices you can buy to use at home, and they kind of give you some biofeedback so you're doing it right. It's almost like you can connect it Bluetooth to your phone and you're playing a video game with your vagina. But it does strengthen those pelvic floor muscles, and so it is effective for decreasing that leakage. And we also now have a treatment where it's like injection of filler into the urethra. We call it bulking agents, and it's actually very effective. It can be done in the office for people who don't want any pain. It can be done under a light anesthesia or whatever, but it's very effective. Yeah.
That's incredible. I mean, look at that. I mean, come to you and all of a sudden it's a game changer, because as women, there are so, like you said, we just kind of say, no, we're fine, but we're not fine.
Right.
And we're going through a lot of changes in midlife.
Exactly. Absolutely. And the last thing you want to do is sometimes if you're leaking, and then, I mean, I don't want to hear that a woman stopped exercising because of this leakage and then doesn't feel good about, we get a lot of endorphins from exercising. It's important for our health. It's just not something you want to stop doing.
Right.
So yeah, it's very fixable and treatable.
So when would be the time that you would say, okay, you've got to come and see me and I can help you? Is that when the UTIs don't go away, or when you just feel, is there a way that we can prevent these things from happening? Do we wait until we have symptoms?
I mean, I think when you have symptoms is a great time to come see me, because everyone's symptoms might be slightly different. One woman might be having recurrent UTIs, another woman might be having painful sex. So I think, when there are symptoms, come talk to me or any urogynecologist. But if you're not sure, talk to your OBGYN about it, and they'll tell you, they'll give you a referral, or they'll tell you where to start.
Well, I think this conversation is so important, because a lot of times our OBs, they're really great at delivering our babies and taking care of us, but then they're like, oh, take an antibiotic, you'll be fine, it's okay, and it's not okay. And so this conversation for anyone who's been suffering is life-changing, really is life-changing. How do people find you?
We can give you my number. I'm on Instagram. I have a website. I have 2 offices. I'm in Santa Monica and Beverly Hills. So
okay, great.
If you're in Los Angeles, I'm easy to find.
Okay, so we're going to collab on this post. Can people DM you if they want? They can find your information. It's all on your page on Instagram?
Yes,
Okay,
absolutely.
amazing. That was revolutionary for me.
Oh my gosh.
And if anyone watching feels like this conversation helped you and could help other women, please share it with your friends and family. Reach out to Dr. Rebecca. She is so amazing, so honest. Really, really, thank you for being here today.
Oh, thanks for having me. And then I was going to say, if anyone has any other questions or topics, that I'd be happy to follow up and talk about more things if there are
Amazing.
questions.
Yes, we have a lot to talk about when it comes to women, menopause, midlife. So we will be doing another interview. Tune in, leave your comments below on what topics you want to hear about, and we will see you all next time right here on Moms Matter.